People of color make up more than 75% of our city's population. So declaring racism a public health crisis, an important move for the Alamo City. There's one problem, though. The resolution doesn't come with a concrete plan on how changes will be made to attain equity for all. We're not the first to make this type of declaration.
On Sunday, we explored how other cities and counties that passed similar resolutions have created change in hopes of seeing what could possibly be done here. Tonight, we hear from residents and local leaders about what happens next.
It's part of our series, Voices of a Nation.
A simple but strong message. The time for action is now.
I don't necessarily see there being a huge push in the resolution to name the specifics of what they will do.
Tramel Jones has lived in San Antonio for more than 30 years. And while she's proud of the city for declaring racism a public health crisis, she's waiting to see what type of changes will be proposed.
I really feel like it's not this reinvent the wheel. Look at the resolution, identify all of those points, and let's reverse.
The resolution doesn't make immediate changes or specify how they'll be made, but it does say the city will review policies that contribute to racial inequities. Glow Armour has lived in San Antonio her whole life, and she believes community engagement is a crucial starting point.
I would love for there to be like a community board or something like that, where they would ask people, what do you want and how can we help facilitate that?
District 2 City Councilwoman Jada Andrews Sullivan agrees. She says the first step to solving any problem is admitting there is one.
Racism is not just something that is written, or it's not just something that we can give a shot for. It is something that is embedded. And until we get down into the root and the core of that, then we start to see a change.
Following the lead of more than 80 other cities and counties that have made similar declarations, Andrew Sullivan says the city is working to identify the inequities that continuously put people of color at a disadvantage.
We look to our Department of Equity that had the Equity Atlas, that had the equity maps, that show what steps we need to truly take.
Those inequities, bolstered by racism, hinder change in our community. Healthcare is a prime example.
We know that racism has an impact on individual health for certain, and then when you take that collectively, it's public health.
Local epidemiologist Charisse Rohr-Allegrini says many people of color lack access to healthy foods, safe parks, and access to health care, which all contribute to poor health. The lack of access can also increase stress. Black people in particular are hit hardest.
We have higher rates of high blood pressure, diabetes, hypertension.
Since making its declaration in August, the city has yet to put forth a concrete action plan. And while Andrew Sullivan says it's something they're working toward, locals are hoping to see some ideas soon, no matter how small.
We're not asking for the moon and the stars. We're asking for matters.
Courtney Friedman, KSAT 12 News.
As we mentioned, this story is part 2 of a closer examination of what it means to declare racism a public health crisis. You can find this story along with part 1 right now on our Voices of a Nation page at ksat.com/voices.